Okay, before we get started, I'm just going to speak first, and I wanted to introduce myself. My name is Anastasia Millman, and I created this presentation as part of my Girl Scout Gold Award. I've been a Girl Scout for 12 years, and if you're not familiar with the Gold Award, it takes over 80 hours of work, and you have to create and coordinate a presentation, or a project, could be a presentation, that's sustainable in your community and on a national level. When I started, I knew that I wanted to do my project on women's health. I've always found a passion in that area, and as I was researching, I found that cardiovascular issues are the #1 killer of women each year. As I continued, I also found that women are often misrepresented. There are large discrepancies between how men and women are cared for in this area. Last summer, I started to intern for BBMI under Elaine Posner, who's now my Gold Award advisor, and my work there helped me to continue to learn about women's cardiovascular health and just healthcare in general. She also introduced me to Dr. Joseph Mahak. Dr. Joseph Mahak is a retired cardiologist and has volunteered at BBMI for 10 years. He worked at Mount Sinai Hospital since 1978, and he went to college and medical school at Brown University. He will first be presenting about women's cardiovascular health, and after that, Isabella, a member of the Wyckoff EMS, will be presenting on how to identify and respond to cardiac emergencies. I hope you enjoy this presentation.
Good afternoon. Thank you, Stacia, for asking me to speak since this is a form of addressing members of the community on a very important subject which is dear to my heart. So as Stacia already mentioned, that women's cardiovascular health has traditionally not received much attention, but it has received much more attention lately. In fact, the topic got top billing at these last 2023 convention of the American College of Cardiology, which is both the American as well as the world's most prestigious organization of experts in this field, that is cardiology. And the keynote address focused on women's cardiovascular health. So this is a very good time to talk about it. Historically, we assume that being young women were at low risk of cardiovascular disease. Cardiovascular means pertaining to the heart and the circulation. This assumption has been a mistake, because already from a very early age, conditions are set in place that determine a woman's future cardiovascular health. And studies show that heart attacks and cardiovascular mortality are increasing among young women. So I will speak mainly about metabolic cardiovascular health. Metabolic means body chemistry, and how the body handles the nutrients that we eat. I will speak about individual risk factors, but also devote some time to systemic risk factors. Systemic meaning that because you belong to a given gender, or because you are a member of a given, say, ethnic or racial group, that imparts certain risks on its own. And in passing, I will mention some incidental cardiovascular health issues as they pertain. So I will speak a great deal about metabolic ill health. That is, ill health because of unfavorable body chemistry. So this presents a high risk for coronary disease, that is disease of the arteries that supply the heart failure, disease of blood vessels that supply the brain, as well as arteries that supply the rest of the body. And the known risk factors include smoking and vaping, a sedentary lifestyle, an unhealthy diet, being overweight or obese, having prediabetes and diabetes, that is a chronically elevated blood sugar, high blood pressure, also called hypertension, high stress, and poor sleeping habits. So, what is atherosclerotic heart disease? When here you see a cross section of an artery. An artery supplies blood to the organs throughout the whole body. So when one is born, that slice is squeaky clean. But over time, even by the time one is a teenager, already there's in various places, there's a buildup of what we call plaques or shallow areas under the lining of the artery, which fills up with either fat or cholesterol. And then, if one has these risk factors, they're already listed: diabetes, smoking, high blood pressure, high fat and cholesterol, and sedentary lifestyle, and more likely in men than women overall. So there's either a gradual buildup or thickening of this plaque, which means that there's less room for the blood to flow through. So it's a partial obstruction. Or this obstruction can occur suddenly because when the lining gets damaged, there becomes a spot where clots form, and therefore that clot can propagate and totally block the artery, causing a crisis in whatever organ is supposed to be getting the blood supply. So now, what is a heart attack? So so the heart is supplied by three major arteries and which branch out, and these arteries, called coronary arteries, to supply the heart. So if it's normal, it's nice and smooth, and these are the blood vessels, they're flowing in the blood. But if there's already a deposit of atherosclerosis, you can see that it's a narrower opening through which blood has to go. So when there's partial blockage, one may experience chest pain during exertion or during stress. When there's total blockage, there occurs like when a clot forms on top of one of these atherosclerotic plaques. So one can experience prolonged chest pain, and because there's injury to the heart muscle because it's not getting oxygen, there's electrical instability. So instead of then heart contracting together all at once, which then generates the force necessary, 80 times or 60 times a minute for all our lives. So instead, it's a chaotic electrical activation, and therefore the heart cannot pump. And so unless one receives emergency care like CPR and electrical conversion to a normal rhythm, about which you're going to hear when I'm finished, unless that happens, that person will die typically within 3 minutes. So now if one survives a heart attack, there's damage to the heart muscle to various degrees. And if either it's a very large heart attack or many successive ones, then the heart muscle itself is weakened and one suffers what's called heart failure. So what is heart failure? So that should be what, not that. So it represents damage to the heart muscle, which results in a weak pump. This can occur from large or multiple heart attacks, or disease of the heart muscle itself, or because one has suffered valve disease. The heart has 4 valves, and therefore if those are not functioning or are too tight or obstructed, that also can cause damage to the heart muscle. Or if one lives with many years of high blood pressure, that causes weakening of the heart muscle. So all of that leads to heart failure. One can also get heart failure when the heart, from very high blood pressure, which causes a marked too much thickening of the heart muscle. So then the heart muscle is very stiff. It doesn't relax, and therefore it does not accept the blood that then it should pump. Again, in some types of valve disease of the heart, or there's some genetic conditions that one may inherit and be born with that may develop into a thickening of the heart muscle called hypertrophy, and I'll mention that in passing at one point. So how does a person experience heart failure? First of all, trouble breathing because the lungs fill with water. Swelling of the feet, which you may notice in some people in stores or on buses, because water accumulates in the legs. One can feel very tired or lightheaded when you get up and try to do stuff, or palpitations, that is electrical instability. Now, metabolic good health can be maintained by a healthy diet, a high level of physical activity, a healthy and stable body weight, adequate rest and relaxation and good sleep regularly, and optimal treatment of risk factors of high blood pressure, diabetes, and high cholesterol. So the recommended healthy diet looks something either cereal or bread made from whole grain or multiple grains, even better, together with low-fat milk or a low-fat yogurt or some low-fat sources of protein. One also may add a piece of fruit, but one should avoid too many pieces of fruit that contain a lot of sugar. So not too much orange juice or too many oranges at one time, or say a big banana because that itself has sugar and starch. So maybe a smaller piece. For lunch and dinner, as the picture shows on the right, at least half of your plate should be vegetables, and multiple vegetables with different colors, because those colors represent healthy chemicals that the body needs. No more than 1/4 of the plate might be meat, and if it is meat, it should be lean meat, that is either white meat or fish, not too much red meat. And the piece of meat should not be bigger than the palm of your hand. And likewise, only 1/4 of the plate and no more should be, say, plants or vegetables that have a lot of starch. That is things like rice, potatoes, corn, or peas. Because again, that's a lot of sugar and a lot of calories. Yes, ma'am?
How big is the plate?
Excuse me?
How big is the plate?
Well, it shouldn't be a big plate. Okay, so that's a very good question, but I mean, it should be a reasonable plate, not too big.
Thank you.
Because even if one is eating healthy foods, one can still have too much of it. So that also is a big factor, so thank you for asking. One of these recommended diets, so for example, a Mediterranean diet actually has the types of ingredients that I already mentioned, or you can have an all vegetarian diet that is also considered healthy. The other important thing is physical fitness. It's a very important part of health and health-related quality of life. And being strong enough, muscular fitness is also important. So one needs to have healthy, well-developed muscles. It's been shown that if one is physically hit in this graph, but you don't have to worry about the details. If one is physically fit, the chances one is going to develop diabetes in life is much smaller than if one is not physically fit. Unfortunately, the amount of work that one expends doing that is as part of employment, that is work, has been decreasing steadily both for men and women over the past 6 decades, 60 years. So therefore, we don't get much exercise these days while we're doing work. Most of the time, we're sitting, or we're standing behind a counter, or just walking in one little area. So we don't get exercise at work most of the time. So we have a sedentary workplace. People commute to work either using an automobile or mass transit. We're sitting on a bus or a train, but there's very little walking or using a bicycle. That is exertion. And then when we're done with school or after work, again, our recreation is mostly sedentary. We're both for children and adults. So healthy physical activity for children is regular engagement in sports activities, playing outdoor games. For adults, it's recommended that a person should spend at least 30 to 60 minutes 5 times a week of moderate exercise, that is walking, weightlifting, or some lower intensity exercise, including dancing. And also, or instead, 15 to 30 minutes 3 times a week of vigorous exercise, that is running, bicycling, or swimming. So I will have to talk about the fact that we are suffering an epidemic of overweight and obesity, as you see in this diagram of what's affecting us. Regardless of whatever measure we use, whether it's in pounds, kilograms, BMIs, or when we measure skin thickness, that is an indicator of how much fat our body has. It's been increasing steadily over the past 60 years. And the impact of overweight and obesity is increased risk for all these disorders or diseases, including high blood pressure, high blood fat and cholesterol, diabetes, coronary disease, that is circulation of the heart, strokes, which is the same condition but involving the brain, trouble sleeping, some cancers, degenerative arthritis, the knees, the back, and ankles, chronic pains that some people suffer, skin problems, and also problems of mood, that is, one is not feeling well, one is feeling sad and depressed. So that is also more common. Now, it is not the fault of those people who are overweight or obese that that's how they got that way. It is not their fault. Because overweight and obesity is a conspiracy of both our genes and our culture. Because we've evolved from hundreds of thousands of years ago from so-called hunter-gatherers. Okay? And such people actually would suffer quite regularly from periods of starvation. So therefore they evolved, they evolved genetically. Their bodies evolved with great efficiency on saving all the excess calories they can get. So instead of wasting them and letting them go, we put it down as fat in case we're starving in the future. So that's how we evolved, and we got very good at it. And also such hunter-gatherers were always moving in search of food all day. Their diet had a high proportion of plants, nuts, fruits, and tubers. And also when there was grain that they gathered, it was coarse, unprocessed. And only a small to modest amount of meat. So even though you think the cavemen, they had plenty of meat, no, their hunting was not always, most of the time was not successful. So they got meat just observing current hunter-gatherers. Meat is actually not frequently eaten by these hunter-gatherers. And only rarely do they have access to refined sugars. So when they were lucky and happened to come upon, say, a honeybee's nest somewhere, they might get it and rob the honey, but that was quite rare and quite a treat. Otherwise, there was no sugar. This is the type of foods I'm talking about that our culture is known for. You recognize these instantly. So all of these are high fat, high calorie foods. And of course, we snack all the time on high sugary snacks as well as sugary drinks, soft drinks. So, and our environment, especially for commercial reasons, we're surrounded by everybody telling us to eat, constant eating and snacking. Okay? So instead of only eating at regular times, breakfast, lunch, and dinner, we're eating all day, snacking. And we're doing that with high sugar, high fat, low quality nutrient foods. So it is small wonder that between our natural predisposition as well as being surrounded by this type of food and to eat all the time, that we result in being overweight. So therefore in children we're seeing now a much greater prevalence of overweight and obesity. And in adults, the average experience that every 10 years we gain on the average 10 pounds. So by the time we're 60 years old, we're already 40 pounds overweight. And some adults are actually genetically susceptible to greater weight gain because they're much better in storing and conserving that a little bit of excess energy they might get in a given day. So therefore, if one is overweight and is not fit physically, it's good to become physically fit by regular exercise that I already talked about, and also by watching one's diet, first of all by eating the right things, the right healthy diet, and also controlling the portions to lose some weight. So therefore, the lowest hazard of early death is in this category who became more physically fit and lost a little bit of weight. Even if one is not able to lose weight, say remain steady, it's still healthier to be physically fit. So even if one is overweight, such people who are physically fit because of regular exercise, their chances of dying prematurely is much lower than people who are not. The worst possible situation is when one is trying to lose weight by starvation, by not eating. So when that happens, one becomes weak because you are losing muscle tissue, so one becomes less physically fit, and at the same, even though one has lost weight, so that group has the highest early mortality. So it's a big mistake to try to, say, solve the problem of being overweight by starving yourself. The other problem is high blood pressure or hypertension. I'm just repeating that because that may not be a familiar term. So high blood pressure increases the risk of atherosclerotic heart disease and both disease of arteries that supply the brain as well as the periphery. And it poses a big risk for either dilated heart failure and a stroke and kidney disease, but also heart failure because the heart muscle gets to be too thick. Diabetes. Diabetes represents a condition where the blood sugar in the blood is chronically too high. That causes changes in the structure of the proteins of the blood vessels, as well as high levels of blood fat and cholesterol, which then progresses to atherosclerosis. The kidneys get damaged, and so the presence of diabetes increases the risk of cardiovascular disease three times greater risk. Now it turns out that the presence of a pregnant mother who is awaiting a child who's already overweight and obese and has diabetes predispose the unborn child to overweight and diabetes right from birth. That's why in infancy it's important to visit a pediatrician regularly, both to diagnose inborn heart disease, which occurs about 1% of the time. That's a very low number, but it's very important to diagnose them through a good physical exam in the pediatrician's office, so it can be taken care of. And very importantly, to instruct the parents on nutrition and well baby care. In childhood, it's important to have regular visits and physical examinations in childhood with a pediatrician. Again, education on healthy life habits, nutrition, exercise, get all the proper vaccinations, as well as detection of the inborn heart disease that were not evident at birth. As an adolescent, extremely important to visit the pediatrician for early detection of risk factors for metabolic disease. Because by adolescence, and we mean as the teenage years, already the habits as well as problems that cause metabolic heart disease are already in place a great deal of the time. There's also need for continued education in nutrition, exercise, health, and sex education, and access to contraception. It's important to be involved in sports and physical fitness, and also to practice methods of stress reduction and getting good sleep. That's especially problematic among teenagers. Also to deal with overweight and sedentary habits. The onset of early menstrual periods before age 12 itself is a risk factor for developing cardiovascular diseases. There's nothing you can do. I mean, this is something that may come in some girls, but it's something important to know about as an early risk factor. So it turns out that the risk to cardiovascular health in women is very closely connected with reproductive health. So the risks for problems of pregnancy include early onset of menstruation, presence of irregular menstrual periods, adverse pregnancy outcomes, the number of children, and lack of breastfeeding. So there's a condition called polycystic ovary syndrome, affects 1 in 10 women, which increases the risk of heart disease 2 times. That is doubles the risk. And even before a young woman becomes pregnant, that if she already has poor cardiovascular health, metabolic health, because of diabetes, smoking, overweight, and physical inactivity, high blood pressure, that itself predicts and poses a risk of bad outcomes during the pregnancy, both a danger to the mother as well as a danger to the child about to be born. The problem of overweight in women is particularly made more striking as a result of pregnancy. So we see here that with the first pregnancy, it is normal and healthy that a woman gains weight. So about half of it is lost very quickly at the time of following birth, and gradually over the next year or so, there is frequently some of this weight is lost. But most of the time, not all of it. So one doesn't return back to what it was before. So now with the next pregnancy, a woman starts with a higher weight, and then so there's an additional gain which is not lost. And with subsequent pregnancies, say a third child, so there's an even greater weight, and it turns out that with subsequent children, instead of losing weight after giving birth, actually there's additional gaining weight. So that is the pattern that occurs. So therefore, having children itself contributes to the problem of overweight, something to be aware of. So being overweight or obese increases the risk of diabetes. Diabetes itself leads to greater risk of heart disease, and diabetes during pregnancy particularly leads to a 7 times greater risk of having lifelong diabetes and a doubling of the risk of having heart disease. The other problem during pregnancy is that of high blood pressure or hypertensive problems. 15% of childbearing women experience a hypertensive or high blood pressure complication in at least one of her pregnancies. So these hypertensive disorders, here they shorten as HPD, are a leading cause of maternal and child death during or following the pregnancy. So these problems include high blood pressure during pregnancy and a condition from the middle to the late part of pregnancy called preeclampsia, which means that the blood pressure all of a sudden goes high. There's damage to the kidneys, and it represents an emergency that has to be treated, with great care. And it turns out that the prevalence of either chronic hypertension or these hypertensive problems during pregnancy is increasing, which is why one of the reasons why cardiovascular problems are increasing in young women. So it turns out that each time a woman suffers one of these problems of either diabetes or high blood pressure in pregnancy, that actually ages the heart by about 10 years, it's been estimated.
Can you say that again?
In other words, the heart ages by about 10 years when there's a complication with either diabetes or high blood pressure during pregnancy. In other words, the woman may be 25 years old, but her heart is 35 years old. You understand what I'm saying? Because it's a head start on cardiovascular diseases that mature later. So women with high blood pressure during pregnancy had an 80% increased risk for the incidence of coronary disease, that is heart disease, and 70% increased risk of heart failure, and an increased risk for developing problems with the heart valves. And these risks are even greater in women who have recurrent high blood pressure problems during pregnancy if they get pregnant more than once. How does prevent these hypertensive problems? By aggressively treating high blood pressure both before as well as during pregnancy and after pregnancy. There's some medications actually that are used to treat diabetes that decrease risk of some of these hypertensive emergencies during pregnancy, and weight loss before conceiving a child also helps prevent such problems. So, young adulthood, already many of these things are set. So while cardiovascular death has declined in women who are more than 65 years of age, there's been a slow decline in cardiovascular death in women 55 to 65 years old. However, death rates have not declined in women 25 to 54 years old. So therefore, cardiovascular deaths have been increasing in young women, which is how I started my talk. So women as young adults need to undergo a risk assessment by their doctor to identify gender-specific risk factors, identify the risk factors that can be targeted for prevention. So in young adulthood, it's very important to practice habits of good nutrition and exercise. Prevent, if possible, excessive weight gain during successive pregnancies. Proper treatment of the hypertensive or blood pressure disorders of pregnancy, and proper treatment of diabetes during pregnancy. Some incidental issues of cardiovascular health. In young adulthood, it is important to check thyroid functions. So when the thyroid gland, that's the gland over here, that regulates the metabolism of the body. That is, it regulates how fast we burn our foods, right? It's like how fast the engine is running in your car. That's a very similar analogy. So if one thyroid gland is overactive, it may cause irregular heartbeats, palpitations, a rapid heart rate, and atrial fibrillation, which is irregular rapid heart rate. If the thyroid is not functioning enough, called hypothyroidism, that can cause a weakening of the heart, and the heart becomes enlarged and weak. In young adulthood, we also, it's not rare to find a woman with these hypertrophic cardiomyopathies, which is actually a genetically inherited condition where the heart muscle gets to be too thick, and that causes a problem. So it turns out it's the most common cause of sudden death among competitive athletes. And I'm sure you have, if you've been listening to the news for the last 5-10 years, some very prominent athletes have suddenly dropped dead on the sports field because of this condition that is only diagnosed after they've collapsed and died. So this condition can cause sudden death, they already mentioned. It can cause palpitations and dizzy spells, and it can lead to heart failure. So, which is important to detect this by screening, getting a physical examination at the onset of participation in competitive sports. In young adulthood, one can also suffer from cardiomyopathies. Cardiomyopathy is basically any condition that causes a weakening of the heart muscle. One can get it from substance abuse, like use of cocaine, which causes multiple tiny heart attacks. One can get it from an infection of a virus, including COVID. One can get it from an inflammatory disorder. So these have weird names that may not mean much, like sarcoid and others. And then one can get rhythm disorders. I already mentioned thyroid dysfunction. Also substance abuse, like amphetamine, methamphetamine, and too much caffeine, all right, can cause rhythm disorders, and then unknown causes. And then also, if one either is born with or develops a problem of one of the heart valves, so that causes problems. So those are some of the incidentals. But we're going to get back to the main issue, and that is metabolic health. So in maturity and old age, it's still important to visit one's doctors for lifelong management of these risk factors. If one has high blood pressure, blood sugar is too high, it needs to be properly treated in order to avoid getting into trouble later. So this combination of high blood pressure, high blood fat and cholesterol, and pre-diabetes or diabetes, and being overweight, that's called the metabolic syndrome. So that needs to be addressed and treated. When a woman eventually, women's reproductive ability ends with menopause, that is when the menstrual periods stop. And given the fact that most women live much longer after they stop menstruating, most women will spend about 40% of their life in menopause. And it is a time of accelerating cardiovascular risk, because even with all the problems I've already listed that affect women, the presence of their hormone estrogen that makes them, to look like and feel like women, the loss of their hormone actually, let me say differently, the presence of hormone estrogens protects women slightly against development of atherosclerotic heart disease. The loss of estrogens then leads to an acceleration of atherosclerosis. So therefore, it's been shown that if in the first 10 years one replaces some of these estrogens by taking hormone pills, that actually decrease the risk of this acceleration of heart disease. But if it is started too late already, when the woman is older after menopause, then it doesn't do any good. If anything, can cause further troubles. So that's something which has been resolved more recently. It's also important for adequate sleep and lifelong exercise, all of which lower the effects of chronic stress. We live in a culture where there's a lot of stress. So its effects on the heart can be reduced by good sleep and lifelong exercise, and in engaging practices like meditation or prayer, so which has been found to be beneficial. So now I would like to address some systemic problems, including, excuse me. So risk due to gender itself, limited access to health care and health education among some populations, and long-term cumulative events already experienced since childhood, young adulthood, and maturity. So gender-related factors. So traditionally, it was thought that young to middle-aged women had very low risk of heart disease. And so therefore, women were not taken seriously when they presented to doctors, nurses, and hospitals with symptoms related to the heart. And that's also because in women, the symptoms of a heart attack are frequently different from the classical ones that we've learned with men, that are the traditional symptoms. So therefore, when a woman presents these kind of not so typical symptoms, her symptoms are dismissed and she's sent home, and then she goes home and she dies from her heart attack. You see? And that happens much too often. And young women who survive a heart attack are much more likely to have to come back to the hospital because of complications during the year after. And women are more likely to suffer side effects and complications from routine treatments and interventions. So when doctors, in a procedure called angioplasty, actually reopen one of the blocked arteries, women suffer more complications after that procedure. So you can see, in some ways, the cards are stacked against women. And then the other is social-economic factors. So low-income families have a greater proportion of being overweight and obese, greater risk of hypertension and developing diabetes. And in some ethnic groups, actually, there's a genetic predisposition for diabetes and complications. So excessive weight gain in childhood and adolescence is more common in populations with low income. And that has many factors. For example, schools in low-income areas are underfunded because our schools are funded through local taxes. And so cafeterias are underfunded, and so therefore they're going to buy cheap, high sugar, high fat foods that are cheaper to get than the better quality foods that I listed earlier. Also, there are conflicts of interest between members of the boards of education and the suppliers, from whom schools have to buy food for the cafeterias. So therefore, such schools have more sugary soft drinks, processed foods, foods high in fat and carbohydrates, lack of fruits and vegetables. Then there's a general lack of adequate physical fitness education. There's limited access to athletics in poorer school districts and limited participation in sports. There's also less time for physical exertion, because if one lives in a neighborhood where it might not be so safe for children by themselves to walk the streets, then they're not going to participate in outdoor sports. And too much time is spent in front of TV, computers, and with cell phones. And too much weight gain occurs in young women with successive pregnancies. Women who are uninsured or are Medicaid have limited or no access to support services during pregnancy and birth. The United Nations Millennium Development Goals called for a reduction in maternal mortality by 75%. Now, it turns out that when this period ran out, there was a 45% reduction was achieved. The United States was the only country among the developed nations where maternal mortality grew, it increased. All the other developed countries showed a marked decrease in maternal mortality. So in 2019, U.S. maternal mortality was 25 out of 100,000 live births, 3 times higher than any other developed country. African American mortality was even double that average, and that was 55 per 100,000 live births. African American women are less likely to receive medical care during pregnancy, and complications are 30 to 50% more common among women of color. Also, pre-pregnancy counseling is scarce for many. About 45% of pregnancies are unintended or unplanned. There are very few opportunities to intervene and optimize health prior to pregnancy under such circumstances, and leaving these women at greater risk for worse outcomes, the ones that we already discussed. Social and economic factors. So problems arise because access to receiving health care is limited for African Americans, Hispanics, Native Americans, and poor immigrants. And that's because of a lack of universal health insurance. Women also take care of their families. They're too busy taking care of their families, and they don't take care of themselves. Social isolation and poor social connections, especially for single mothers, increase the risk of heart disease by 27%.
What?
Right.
Terrible.
Women from Black and Latina communities experience the highest rates of cardiovascular disease and mortality. And there are disparities in the application of standards of medical care in these women. So even when these women present to emergency rooms and hospitals, the doctors and nurses don't even follow standards of accepted health care. In other words, these women are cheated of receiving the kind of health care they should get, according to what all the experts agree on. So ethnic minorities has the highest rates of overweight associated with health problems. 77% of Latino adults, 38% of children are overweight or obese. And cardiovascular disease is a major concern within the Latino community. There are barriers to medical and preventive care, lack of insurance, lack of consistent medical care, living in medically underserved areas. And Latinos are less likely to receive medical screening and treatment for heart disease. And they're more likely to die from it than any other ethnic group in the United States. In middle age, these social and economic factors continue because there's continued weight gain, sedentary lifestyle, and therefore blood pressure, hypertension, prediabetes, diabetes, high blood fat, and cholesterol, it accumulates. So therefore these problems are showing up, but they're not being addressed. There's also, for this population, they have poor access to supermarkets and healthy produce. So if you live in the inner city, you don't have access to all the nice vegetables that we enjoy here. They have to buy their food in the grocery stores and bodegas, and there the choices and supply of fresh foods and vegetables is much more limited. And they also have poor access to physical activity, long distance to public parks. When a woman becomes in old age and is poor with low income, such women suffer neglect, poor access to health care to manage ongoing health issues and complications, lack of access to physical activity, limited access to a healthy diet, limited access to emergency services. So where are these women at such high risk? They are our neighbors in Bergen County. They work in the store, supermarkets, restaurants, dry cleaners. They clean our houses. Their husbands drive delivery trucks, cut our lawns, work in stores, construction, maintain our homes, in the kitchens of the restaurants we eat in. Unfortunately, their employers don't provide health insurance for them. These families cannot afford to buy health insurance on their own. and these women do not have access to health education and medical care needed to maintain good cardiovascular health. I see many of such patients at the BVMI clinic in Hackensack, where I volunteer as a physician. Most of my patients are immigrant women from South or Central America, and most of these women go without help. But there's good news, because all of these problems have solutions. They already know, they're already with us out there. So one is more effective education on healthy nutrition and physical fitness, starting from a young age in our school systems and in the newspapers and the mass media that often neglects all of this. Another is universal access to health care, as every other industrialized, advanced country in the world offers to its citizens. We don't. Because in childhood and adolescence, early prevention can prevent running into trouble later. Reproductive health care, I already said, is extremely important on preventing the complications of pregnancy in young women. And in adulthood and old age, early access to health insurance and health care can help prevent and treat the risk factors associated with metabolic disorders and diagnosis of some of these incidental conditions that affect the heart. So, I thank you very much for your attention, and I will be happy to answer any questions. Yes, ma'am.
Dr. Maha, can you tell us what the symptoms are for a heart attack in women? You said they're different. Do we know what they are?
Right. So the typical symptoms of a heart attack, the classical symptoms, will be a squeezing pain in the middle of the chest that lasts more than a couple minutes. And in fact, if it lasts only a short time, it will be a symptom of partial blockage, called angina, and sweating, rapid pulse, and perhaps trouble breathing. But many people, both men and women, but especially in women, such symptoms can be a pain in the shoulder. It can be only a pain in the neck, up here. Or it could be a pain in the back, you see? Or, very commonly, also pain in the stomach area, you see? And the symptoms of, not a heart attack, but of, say, partial blockages, which signals a heart attack in the future, possibly. So classically, it is a type of chest pressure discomfort when one exerts yourself, when you're walking or climbing stairs. Whereas in many women, they don't get this pain. They may get an ache in the shoulder, so it's mistaken for arthritis. Or it can be a pain going to the neck or going to the back, or pain in the stomach. So in areas where one can easily write it off as stomach problems, arthritis, or a headache, anything like that, so it is mistaken. So one has to pay very close attention, and especially elicit if this woman has the risk. You see, we take it more seriously if we find out that the woman has high blood pressure and high cholesterol, and perhaps has had complications during pregnancy. See, so one has to take that into account. So since we have a short amount of time for that, that's as best as I can explain in the time period we have.
Thank you.
Any other questions? So in that case, thank you very much, and I'll be happy to answer questions even later when we're finished.
Isabella Imparato. I am a volunteer EMT with Wyckoff Ambulance Corps. I have been a certified EMT since February, so I am relatively new. But I'm going to be talking to you today about cardiac emergency and like the response system that we have here in Wyckoff. So I'm going to first start off with a brief timeline of a cardiac emergency. So the first step is realizing the problem. The second step is dialing 911. Then we have emergency response coming. We have our assessment, which will be done by an EMT or can also be done by a paramedic. And then we have transport as our final step. So step one is realizing the problem. So this is when you are feeling a difference from your normal baseline health. So that can be a squeezing, tightness, or pain in your chest. You could also be feeling pains going in your arms, going up to your neck, into your jaw, and even sometimes you can be feeling it in your stomach. Sometimes that can be based off of like acid reflux. You could be feeling that as well. So anything that is like different from what you normally feel, it is a sign that you should be checked out. And one of the biggest things is if this happens suddenly. So one of the biggest things that we ask as an EMT is, what were you doing before this happened? Were you just sitting down on the couch and then all of a sudden you just felt like a tightness in your chest? Or did you feel like you could not breathe? Did you feel something else? Or were you lifting weights earlier in the day and you might have like strained a muscle? Something like that. That can help also with us figuring out what types of medications we can give you and how we can proceed going forward. And finally, we're gonna wonder, is it worsening over time? Are you feeling worse, like as the day goes on? Are you feeling like you still can't catch your breath? Are you feeling like the pains are just unbearable? There's more tightness? And if that's a yes, then this is something that you should definitely be getting checked out. So step two is dialing 911. This is a very hectic time. It's a very tension's high, anxieties, everything is very high. It's one of the worst moments of your life where you're feeling like, oh my gosh, I'm not feeling my best. This could be you, it could be a loved one. It's not the best time at all, but you want to use any phone to call 911, doesn't matter what. You need to just tell the dispatcher, they'll answer the phone, they'll say 911, what is your emergency? And you're gonna say, hi, my name is, I'll say my name is Isabella, I live at this address, and this is what's going on. They're gonna then ask you, well, do you need any emergency services? Do you need an ambulance? And you will say yes, and then the ambulance will come. So step three is emergency response. So we're gonna wanna keep our doors unlocked right after you call 911. Keep your doors unlocked. That will make sure that the police officers and the EMTs can get inside the house faster. You want to put any pets away. I know we all love our furry little friends, but for right now, you want to keep the pets away. That just helps us make sure that you don't want to worry about your pet running outside. You want to make sure that they are kept away and they don't intervene with any of us. So normally the police, they will always show up first. Now we're very fortunate here in Wyckoff. Mostly all of our police are EMT certified. Most of them have gone through the EMT course. So if you have any problem that's going on, they check your vitals most of the time before we even get there on scene. So it's very assuring to have that. They help EMTs all the time in this town. And then we also have ALS and BLS. So ALS is the paramedics and BLS is me, an EMT. So what is ALS? ALS is advanced life support. They are able to do pre-hospital procedures for a cardiac emergency, just like an EKG. And an EKG is an electrocardiogram. It records electrical signals from your heart to detect any issues. Now this might sound like a scary thing, but the paramedic comes in with this big box, it's portable, and they basically attach a bunch of, I like to call them stickers, just as an easier response. There are a bunch of stickers that go on your chest, your abdomen, sometimes they'll even put it on your arms, and it's just recording the waves of your heart beating. And the paramedics are able to give medication if necessary through IVs, which will be easier access for the medications to get where they need to be, rather than taking like an oral aspirin would. So what is BLS? BLS is basic life support. That is an EMT. We are able to take vitals, so that's just a baseline like blood pressure. We're able to do pulse rate. We can check your breath sounds with a stethoscope, and we also just look at your rate of breathing and your overall like chain of health, like how you're looking, what you're presenting with. If you're looking like you are out of breath, if you're sweaty, if you're pale, if you're cyanotic. That's what we normally look for. And we can also administer oral medications for cardiac issues. Mostly we will do like an aspirin, or if you're prescribed nitroglycerin for yourself, you would know if you're prescribed it. We can help you assist with that as well. So if ALS arrives before BLS, here in Wyckoff we do have a pretty good turn rate. It's about 50% of the time ALS might come before BLS does, or BLS might be there before ALS does. But if ALS comes first, they will take down all your information. They're going to introduce themselves. They're going to ask like what's going on, what seems to be the problem. They're going to take down all of your medical history, and then they will start doing their assessments, taking the baseline vitals and the EKG as well. And they'll give you any medications as necessary. While this is going on, BLS, we will arrive on scene. We're gonna get the stretcher ready for anything. We're gonna help assist anything that ALS might need, whether that would be just helping them with the wires, the cords, because there's a lot of wires that go on with the EKG. And then we also help assist you onto the stretcher. And then if BLS arrives before ALS, so we're gonna first introduce ourselves. So for example, I'll walk into the house or wherever the scene is, and I'm gonna say, "Hi, my name is Isabella. I'm an EMT. What seems to be the problem today?" You're gonna tell me what's been going on, and then I am going to be very annoying, and I'm going to ask you a bunch of questions about everything. I am going to ask you the symptoms that you have been having, if you have any allergies to medications or even to foods, if you're on any certain medications, what you last ate, your past medical history, and what you were doing before this event happened. That is the biggest thing. We need to know what you were doing before it was going on, because like I said earlier, you could have just been sitting down on the couch and all of a sudden you have crushing chest pain, or you could have been moving a refrigerator and you could have just hurt a muscle, and that will help us figure out if we want to give you a medication like aspirin or not, because aspirin is an anticoagulant, which basically just means it's like a blood thinner, but it helps with it's an anticoagulant. So if you have any like bleeding going on in your body, it makes your veins bigger, so it will make your veins bigger, and then it will cause more bleeding in the body basically. So if you already have something going on, like a pulled muscle where there is bleeding going on, we wouldn't want to be giving you any medications to prolong any bleeding. And then ALS will arrive. If ALS is not available, BLS will typically administer aspirin for a cardiac emergency or nitroglycerin if you have it. So this is the file life. I have some for you guys to take after the presentation, but this is a very important document. You can hang it on your fridge. It's a little magnet. This basically, it has all of your information on it. Not only your like address, it has your emergency contact information, and it also has your allergies, medications you're on, the preferred hospital you like to go to, any past medical history. We strongly recommend that everyone would have these in their houses, because a police officer can go straight in, they can check it, they can see all of what's going on with you, and then we can bring this to the hospital as well. It just makes time on scene a lot faster, and we can give you the help that you need a lot quicker. This is also really great, especially if you have family members that live alone, like grandparents. I know a lot of the time, a lot of grandparents, older people, they have a lot of medications that they have. If it's all written down in one area, we could just transport it with us, and it makes the time on scene a lot faster. So I'll hand this out to you guys later on if you guys would like them. And then step 4 is the assessment. So we're going to be taking vitals, we're going to be checking your pulse. That's just a simple, just going right here with your fingers, just checking to see what your pulse is. We're gonna be checking not only the pulse rate, but also if your pulse is steady, if it's erratic, if it's weak, if it's strong. We wanna know all those things. We're gonna be checking your blood pressure, seeing if it's high, seeing if it's low, and the blood pressure is also most important because it tells us what types of medications that we can give you. Certain medications are blood pressure based, like nitroglycerin, so we need to make sure that your blood pressure is high enough before we give you something that will make your blood pressure go lower. And then we'll also be checking your breathing and your breath sound. So we'll be checking how you're breathing. We'll be seeing if you're like clutching your chest, if you're breathing really deeply, if you're breathing pretty shallowly, if you're breathing fast, if you're breathing slow. All these things can contribute to a cardiac emergency. Then we will be assessing your physical state. So as I said before, we're going to be seeing if you're out of breath. We're going to be looking at your skin tone. The normal baseline for skin tone is pink, warm, dry. So if you are skewed from any of those, then that is also a sign that you should be checked out by something. So we might see, are you sweaty? Are you pale? Are you cyanotic, which means little blue sometimes around the face, especially that happens in the winter time. If you're cold, you might see some blue in your fingertips sometimes. That's what that is, but it can also occur around the mouth and nose. And then it also gives the possibility of giving you any medications. Step 5 is transport. So we will be assisting you onto the stretcher. Sometimes you'll be able to walk on the stretcher. We might just give you a hand. Other times you might be on the ground. We've seen it all. We are here to assist you with anything. We have a bunch of transport things. We have a stair chair. We even have a Reeves. We can pick you up. No matter what, we will always get you on the stretcher, and we will be buckling you up. So you're gonna have two buckles right across the chest. You're gonna have one around your abdomen and also on your legs. You are gonna be in a moving vehicle, so we have to make sure that everyone is safe. And when we're in the back of the ambulance going to the hospital, sometimes it will be ALS and BLS back there, depending on how severe the issue is. Sometimes the paramedics will release you just to a basic EMT if everything is checking out and seeming like it's not that big of a deal. But when we are in the back of the ambulance, we're going to be rechecking your vitals again. We're going to be checking your pulse rate, your blood pressures. We're going to be asking you if you feel any improvements. If you don't feel an improvement, if you're telling us that you're feeling a new symptom, like you're feeling faint, everything, you will be just telling us that so that we can give a proper report to the hospital. So then we will arrive at the hospital and we're going to check you in. We're going to give a report to the nurse. We're going to tell them what has been going on. They're going to ask you the same questions that we were asking you previously again, and they will be checking your vitals again. And then you will be brought into a room where we will then put you onto the hospital bed, and then you'll be assessed for definitive care by a doctor or nurse. And finally, so the prevention of cardiac emergencies. So we want to be eating healthy. As they say, an apple a day keeps the doctor away. It is really true. We need to have a healthy, balanced diet. I know not everyone can be perfect. We all like to have some cookies. We like to have some cake sometimes, but we have to be mindful of what we are eating. We always want to be having a very well-balanced diet, whether that would be fruit, vegetables, proteins. We need all of that. Also, going for your yearly checkups at the doctor, it is very important, especially at a young age, that you have your yearly checkups. Your doctor has all of your health information. They're going to want to make sure that you are at baseline health at all times. And also, you should be going to the doctor if you do not feel good. If you ever feel like you are not feeling right, call your doctor immediately. Try to book an appointment with your doctor. And if you feel like your symptoms are worsening, call 911. If your symptoms are feeling worse and worse, just call 911. It does not matter if it is 3 o'clock in the morning. We will be showing up trying to help you. And if your symptoms aren't really seeming as bad as they were, we can always release you and you can go to your primary care physician in the morning. But if you have any anxieties in the middle of the night and how you're feeling, just call us. We will do a full set of vitals for you. We will make sure that you get the help that you need. And that is all. all. We do not want anyone to be worsening and waiting weeks for a doctor's appointment, and then all of a sudden your cardiovascular health has declined rapidly, because that can happen very fast. But that is the end of my presentation, just talking about anything pre-hospital setting for cardiovascular emergencies. So if anyone has any questions, feel free to ask. That's it for me.
Just before we wrap it up, I wanted to thank Dr. Mahak and Isabella for presenting and being really great to work with throughout my entire presentation. I also wanted to thank the Wyckoff Ambulance Corps as a whole, Vivi Mai and Elaine Posner as my Gold Award advisor, the Wyckoff Library, who I also worked with on another portion of my project. I created a Heart Healthy book display there that will be up through the end of May. And then as well as Girl Scout Troop 79209, as they were all able to attend, and I'm going to be making a badge with them soon, and everyone else who was able to come today. Thank you.